Although there are many problems that occur in and around the elbow, this technique is primarily to restrict painful end range of motion in flexion or extension. Here I'm going to restrict extension. For this technique you're going to need 50mm elastic adhesive bandage, 50mm zinc oxide tape, underwrap and taping scissors. Make sure that the area to be taped is clean and not too hairy, as this can impede the effectiveness of the tape. Wash and shave the area if necessary. Apply hypoallergenic balm, underwrap or adhesive spray as applicable to the person being taped. Here I'm using underwrap. This technique can be done with the patient standing or seated. For ease of taping and comfort for the patient, I always ask them to take a seat. As I'm going to wrap around the muscle bulk, I'm going to use elastic adhesive bandage as my anchor above and below the elbow joint. Remember, when using underwrap, it's advisable to get some purchase of the tape on the skin. I'm going to pull some tape out and allow it to spring back on itself, as we don't want this to be too tight and constrict this region. My lower anchor is going to be approximately mid-forearm, and the top anchor is going to be approximately in the middle of the upper arm. Remember to follow the natural contours of the limb. Using a zinc oxide tape, we're going to apply a similar fanning technique as used on the knee. The difference here is that we're going to ask the patient to flex their arm so that the elbow is bent. This means the central part of our tape won't be touching anything. We build up our strips from anchor to anchor, working in a fan-like manner, always making sure that the central section of the tape is across the cubital fossa, but not touching it. I use this as a focal point for my fan. Before testing, it is advisable to re-anchor over the strips so they don't pull off. Here I'm simply closing the tape prior to testing. Closing for this technique, we are going to use a 50mm elastic adhesive bandage to cover the tape job. Starting distally and working proximally, wrap the bandage around the forearm up to the upper arm, being careful not to pull the tape too tightly.